Good afternoon, everyone. This is Dr. Simi Tiwari. I am Joint Director and heading the Division of Zoonotic Diseases at National Center for Disease Control, which is the apex organization for Ministry of Health and Family Welfare for all technical perspectives with outbreak investigations and other non-communicable diseases as well.
So, welcome to this lecture session on the community participation. We all know that community participation is the key strategy to achieve many of the stated health goals and objectives, not only at the country level, but at the global level. So, we know that by now you might have learned a lot about the One Health and the core domains of One Health. So, today we will be learning about what exactly is the community participation. So these are the learning objects. We will be learning on few of the key aspects about the community participation. What is community participation known as? Why community participation is required? What are the principles of community participation? What are the different levels where we observe and we implement the community participation strategies? Who all are the stakeholders for community participation? What are the different theories given as of now for the community participation aspects? And what exactly we understand by the principle of community participation in One Health. So if we look at the community participation, there are many definitions which has been given, and this is not an activity, but this is an approach. This is a principle to achieve the stated goals and objectives of our many of the challenges, not only limited to the health, but other social issues as well. Charles Abrahams has defined the community participation as the theory that the local community should be given an active role in all programs and policies, and so that they can lead to a direct improvement, which are all the problems which are affecting a community directly. And WHO has also given a definition for the community participation or the community engagement as a process of developing relationships that enable stakeholders to work together to address health related issues and promote well being to achieve positive health impact and the outcomes. There are many myths which is stated by Goethe in way back 1999. The myth that the affected population is too shocked and helpless to take responsibility for their own survival is suspended by the reality that, on the contrary, many find new strengths during an emergency. So, this is a paradox for the community participation. So, if we overall look at the community participation, it is an enabling exercise to achieve the stated goals and objectives with an active participation of the community in which that particular problem is existing. So what is community participation in broader sense? We understand by community participation is the active engagement of all the people for solving their own problems. It is essential for the success of all development and social changes initiatives. And in public health, it refers to the efforts that promote a mutual exchange of information, understanding, ideas, and also sharing of the resources between the community members and the health department. So this is in a broader sense what we understand by the community participation or the community engagement. So why community participation is essential? Why community participation's approach that has been brought to achieve the health objective? That we all know that half of the world population still have lack of essential health services. And we know that more than 100 people, they are still having uh, about more than 100 million people, they are still being pushed into the extreme poverty because of excessive healthcare expenditure, and they have to bear this expenditure on healthcare services out of their pocket. So what is the poverty defined as living on US dollar 1.9 or less in a day? As per the UN data, more than 800 million people, that almost constitute more than 12% of the world's population, they spend at least 10% of their household budget to pay for the healthcare. That means the out of pocket expenditure. And this level of healthcare expenditure that lead to the catastrophic health event and in turn start a vicious circle of poverty. Poverty leads to the ill health burdens on the pockets of the poor people, and then again they are pushed back into the poverty circle, and then again a cycle of ill health starts. So this is a kind of vicious circle for which we need to involve the community to achieve the objectives. And there is a United Nations call for achieving the universal health coverage by 2030. And this is also a part of sustainable development goals, in which the community participation is also one of the stated approach to achieve these goals by 2030. What do we mean by universal healthcare service, healthcare coverage? It is not only to ensure the individual treatment services, but also to have a population based services such as public health campaigns, like a simple problem of adding fluoride content to water to address the fluorosis problem, and to look after the vector borne diseases like malaria, and look out how to have the community participation in controlling the mosquito breeding grounds. So these are few of the examples that why community participation is required. And universal health coverage, which is also entails the importance of community participation, also includes taking steps towards equity. Means all the healthcare services are available to all the stratas of the community uh, at affordable prices, and all the health services are accessible to all. And also to develop the priorities as well as social inclusion and cohesion. There are few principles laid down for a successful community participation, which includes that there should be a mutual trust. If the trust is not there, we cannot establish a successful model of community participation. We should be looking at the accessibility. If we are not ensuring the accessibility of the particular healthcare services, then we cannot ask a community to participate in solving a particular healthcare issue. Then contextualization is an important, that is to understanding what is the value to the community and working on the community's perception of value that leads to a better better engagement with the community stakeholders and community people. Equity is a key principle to derive the effective community engagement process. The equity should be an inbuilt principle of any kind of community modeling exercises, so that we can effectively implement a kind of community participation model to address a particular healthcare issue. It successfully addresses, and it should be a closely linked to the congent engagement practices. Means equity, until and unless we are not bringing equity in our key program designs, healthcare services are equitably distributed to all the stratas of the community, we are not addressing the community participation in a justifiable manner. Next important principle is the transparency, which is essential for trust building, and this should be promoted for having the another enabling factors which are required for the effective community engagement exercises. Autonomy and freedom, that is also one of the important principle for effective community participation. It develops autonomous and empowered individuals. If we give the autonomy, if we bring the autonomy in the decision making in any kind of community participation model, and it should be utilized as a powerful approach to influence even the policy drivers and advocacy for the change. There are different levels for the community participation, level 1 to level 4. What is level 1? Level 1 is only community oriented, in which we just inform the community about a particular health problem, and we try to mobilize by the various theories, various interventions, so that they come ahead for participating and in addressing the immediate health issues or immediate any kind of social issues. So this kind of community oriented level 1 community engagement is utilized to address the short term concerns, and but it requires a strong external support if we want to mobilize the community just by informing them. Level 2 is community based, in which we involve the community in the consultation process, and we involve them to improve the particular condition, not only related to health but other social issues as well. And we involve the community in the various programs by involving them in locating interventions that where we need to implement a particular strategy, or where we need to intervene inside the community, and the level 2 of community participation that requires a little external support to be successful. Now level 3 is all the interventions wherein we have a greater involvement of community, and the particular intervention that is wholly managed by a community itself. There is an active collaboration with the leaders of the community to enable priority settings, and also involving them decisions from the people themselves, with or without any kind of external support of partners. So at the level 3, we see a greater engagement of community, community coming ahead to manage their own issues, to manage their own health problems or any kind of social issues. Level 4 is to the next level, wherein community owned itself a particular problem, and they are fully mobilized, and the community is empowered enough to develop their own systems for self-governance, to establish and set priorities, and to the required intervention to address that particular problem. So this kind of level 4 community engagement is in a true sense a community participation, wherein community owns a problem and also comes up with a self-sustainable solutions. So there are many factors which influence the success or failure of a community participation. Number 1 is the governance, developing roles and responsibilities within the community and building on existing capacities to enhance the community participation leadership. Third one is an important decision making powers in the community. To what extent we are giving a decision making powers to the community leaders or the community itself. Fourth is to establish an effective communication and collaboration and partnership among the various groups of the community. So this is also one of the very, very important factor to have a successful community engagement, to have a transparent communication and collaborative mechanism. And fifth, which is very important, that we should be having and ensuring the available resources. We should be ensuring the availability of particular services, and then only we can expect that a community is actively participating in addressing a particular health problem or any kind of social issues. So if we look at the stakeholders of community participation, there are many stakeholders. Stakeholders is a single person. It could be a group, or it can be an organization involved in or affected by the development and completion of a program or policy. To line few of the stakeholders, although there may be an n number of list of the stakeholders for community participation, it depends how we design a kind of need assessment strategy for designing a community participation program for a particular health issue or any other problem. So to list few are the general population is one of the important that do we mean by the community is the general population only. But within the general population, we can have the targeted approaches, and we can outline few of the specific cohorts which need to be targeted for a particular health problem. And accordingly, we devise our strategies for community participation models. And secondly, we have in the community many of the donor organizations or the philanthropic organizations. There may be many field functionaries of all the sectors which need to be involved: health sector, veterinary sector, panchayati raj organizations, or other state actors and non-state actors. Political leaders, they are very important group for the successful community participation exercises, and local influencers. They may be political or they may be a social worker also. By virtue of their face value, they play an important role in community participation models. And religious leaders, they are a very important and they have a very important role in building a successful community participation. Local authorities. Local authorities means local self-government bodies, urban local bodies or the rural local bodies, panchayati raj institutions and their members, gram panchayats, pradhan, and all the local self-government authorities. likewise, we have very important community participation stakeholders in the form of non-government organizations, community-based organizations, and many of the self-help groups which are active in the community. They play an important stakeholder in exercising the important community participation. Apart from these, the industry and the business communities, a local vendor, local shopkeeper, or a big industry or big factory malik, owner of a factory. So they also a very important target group for involving in the community participation exercises and to address a particular health problem. There are many theoretical models which has been given for the community engagement. I will be reading a few. There are behavioral change theories which has been given, like self-determination theory. In this theory, it is stated that this is a self-motivation of a particular community or a particular group of individuals that they determine to the extent what changes are required to address a particular health problem or a particular social issues in their defined geographical area. Similarly, there is a behavioral change ball by which we mean to have some kind of social networks are existing of relevant stakeholders in relation to health. And these social networks, they collaborate and communicate within themselves, and they lead a behavioral change movement in a particular society or community. And then community-based system dynamics. This is a group model building by facilitating the teamworks. It needs a project head to be there to address these kind of intervene in community participation by this theory or this theoretical model. It uses many visual representations and scripts are laid down, and we identify the participants through gatekeepers, and then we truly engage the community in solving problems in a strategic manner and using the participatory learning actions by involving or by actively engaging the community cohorts. Second important model is the participatory action research, wherein we come forward, we design a particular participatory action research model, and we involve the community members to jointly analyze and to reflect and to chalk down few of the issues which are a bottleneck to meet a health outcome. Then we go ahead with involvement of community members or stakeholders to co-design and co-create the projects to reduce or to address many of the health inequities. And further, we incorporate the participatory monitoring and evaluation. And this participatory monitoring and evaluation, this is an inbuilt design in the community engagement exercise. Participatory action research uses the self-organization of communities. So this participatory action research model is a very powerful model, and it has been successfully implemented in addressing many of the health-related issues like utilization of enhancing utilization of contraceptives in a resistant pockets of the community, to address or to improve the vaccination coverage in the resistant pockets, to address many of the issues. So this participatory action research is basically a qualitative model of research wherein we address the why and how questions, and then we involve the community that how we can address these issues by enabling community environment. Community participation is relevant in many different sectors. To name a few are the community participation exercises in the urban development. Then secondly, in the designing and developing many of the educational programs, many of the healthcare sectors issues that has been successfully addressed by the community participation model. Agriculture sector, then developing gender parity, then addressing various environmental issues and sustainable environmental problem in climate and health, and then the infrastructure development, or we know developing the smart cities in today's concept. So these are the few, but there may be many other sectors wherein community participation is important. So now, what are the steps of the community participation? There are 6 steps I have laid down in this particular slide. First and foremost step is that we should be knowing about our problem, and then we set our research question and set the goals and objectives that what we want to achieve out of a community participation model. Second is we strategically identify the gaps and bottlenecks, and we undertake various types of studies, behavioral studies, anthropological studies, and a very popular type of study is the knowledge, attitude, and practice, that is the CAP studies, to understand the existing mechanisms, to understand the existing problems and their behavior of a particular community towards that problem, and why they behave in a certain designed fashion, why they are behaving in a certain manner, why that particular health condition or a particular social problem is lying just because of community behavior, and what are the various factors driving a particular behavior of a community. And we identify the gap to know what are the different roles of the existing stakeholders in that particular community to address that issue. And then we lay out and then we come out with a strategic design of a community model. And also at the same time, while we are laying out the strategies and we are charting out our actions to be undertaken, we identify the resources in terms of all the money, man, and material, that what exactly we would be requiring to implement a community participation model in a geography, in a particular geography, to address a particular issue. Then we undertake required trainings and capacity building exercises with the community partners and leaders. And then we implement and reassess, and then we review and redesign the community participation model. And then we go on, if we look at that, we are able to achieve the goals and objectives, what we have set in the beginning, then we go on to have a maintenance and consolidation strategy. Community participation it is not a one-time exercise. It is a continuous process, and we should, once we are implementing a community participation model, we should ensure that a particular exercise is sustainable. Rather, it should be self-sustainable. Now, few examples I will be giving in the healthcare sector. So the term community participation in healthcare points to the idea of partnership and shared responsibility with the health services. If I want to give some kind of the community participation in healthcare, I have already spoken about the, improving coverage of utilization of contraceptive among the reproductive age group of the females, as well as male contraception usage. And also one of the important example, which is again and again given in the healthcare setting, is the looking out the breaking the barriers of immunization acceptance. There may be many of the resistant pockets where the polio was not accepted at one stage. But through successful community participation model, we have been able to break the barriers, and we have been able to address the bottlenecks in adopting the polio immunization in the resistant pocket. There are many other examples like coverage and improving the access, improving the coverage of antenatal care services, and improving the coverage of institutional deliveries by successful community participation model. So these are the few examples wherein community is a general community, and another spectrum of the community participation is the healthcare provider. So these are the many these are the types of problems which are addressed through community participation, like behavioral, cultural, and social conditions. I have already given a few of the examples. And second, for example, in the behavioral, cultural, and social conditions, we group the vaccinations during outbreak response, awareness on harmful products like tobacco, alcohol, smoking, exclusion like some kind of transgender communities, they are excluded from the society, gender bias, and drunk driving. So these are the behavioral, cultural, and social conditions which are successfully addressed by the community participation. Then health system determinants like access to appropriate and acceptable primary healthcare services, information, and programs for communicable as well as non-communicable diseases. Thirdly is the prerequisite for health, like access to appropriate and acceptable primary healthcare services, information and programs for communicable and non-communicable diseases. And fourth is the upstream driving forces, like to address the poverty issues, to address the poor working conditions, climate change and health, environmental degradation that led to many of the emergence and re-emergence of the infections. Then demographic changes, epidemiological shift in many of the health problems, rapid and unplanned urbanization, which can lead to adverse impact on the health of a community. So these are the type of problems which are addressed by the community participation. Level wise, we address the community in the various setting, and we identify who are the which type of groups they form a immediate point of contact for addressing a particular health problem or particular social issue through community engagement or participation. At first and foremost, community is the family that constitute a fundamental community, the main provider of healthcare, and have a fundamental role in the health promotion. Secondly, the community we do understand by having our close friends and neighbors. And second, the larger all people in and around the society, or where do we live in a particular community. So these are this is a different mode of defining various levels of community, and we can have a particular strategy built by having a look on these kind of these groups of community, and accordingly we can design our strategy. Now coming to the community participation in One Health, we have already learned a lot about the One Health. We know that what is One Health. It is defined by WHO. It is an integrated unifying approach to balance and optimizing the health of people, animal and the environment. It is particularly important to prevent, predict, detect and respond to the global health threats, such as we all know about the COVID-19 pandemic, but to name a few other are the Nipah, Ebola, and many of the dreaded infectious diseases which require the One Health approach. So One Health approach to design and implement the program, policies, legislation and research, wherein we envisage the involvement of multiple sectors and communities who intend to work together and to achieve the better health outcomes than before. It is critical to address health threats in the animal, human, and environmental interface. So, One Health is a globally acclaimed approach in today's scenario, wherein we are facing a double-edged sword. We are facing the rising burden of communicable as well as non-communicable diseases on one or the other spectrum. So, One Health approach that addresses both the things. If we look at the historical perspectives, I think I have already taught in one of the few slides, One Health historical perspectives. Way back in the Hippocrates wrote that airs, waters and places, they are the harbinger of One Health concept. And in the 19th century, Dr. Rudolf Virchow has written, between animal and human medicine, there is no dividing line, and nor there should be. And Dr. William Osler studied the link between human and animal health. And way back in the Bohr Committee in 1946, they have suggested that health and development, they are interdependent, and nothing can be, partly addressed. They are linked together, and there should be a strong intersectoral and intersector coordination and communication. And in 2004, human and animal health expert at a symposium convened by Wildlife Conservation Society, they extended the concept of one medicine to One Health and One World. So these are all the historical aspects and perspectives of One Health. In the One Health, we have a role of human health partner, basically, and secondly, the animal health partner, and third is the environmental health. So there are many stakeholders of One Health, but to name these three sectors are the key sectors for the active community participation in One Health scenario. There are core domains of One Health, which are defined as 4 core domains: prevention of zoonotic diseases in animals and people, food safety and security, addressing the antimicrobial resistance, and conservation of biodiversity, and addressing the land use changes. One Health is not only limited to the communicable diseases or these 4 domains, but it expands its arms to address the chronic diseases, mental health, and occupational health as well. So these are the key stakeholders. In the previous lectures, we have already covered these key stakeholders. We know that health department, veterinary, and the forest department. And apart from these, the climate department, they are all key stakeholders of One Health. So how we address the community participation for One Health? We need to educate the people about the interconnection between the human health, animal health, and environmental health. We need to create an awareness in community that how an unsafe close contact with the animals and their environment can lead to disease transmission between the animals and people. And we need to understand the people's perception about their risk and vulnerabilities to the zoonotic diseases and their interaction with each other. And if we want to address these core domains of One Health by community participation, as we understood by the previous slides, we should involve the communities by having them in active decision-making processes, to have their role, to have their understanding that what preparedness and mitigation activities will be effective in addressing that issues within their cultural domains and within their cultural beliefs. And also we should be involving the communities in designing, implementation, and evaluation of the risk at the community level. And then only all these core domains of One Health can be addressed through a successful community participation models. We have we are looking at the core domains of One Health, but to have a look at the key messages, I have just outlined 2 examples of the One Health core domains. One is the antimicrobial resistance, and second is the food safety measures. For antimicrobial resistance, we should be designing a community participation model on these key messages, like excessive and unnecessary use of antibiotics for people, animal, or plants can cause side effects and contribute to the antimicrobial resistance. The people and community, they should avoid contaminating the environment like water and soil with human and animal waste, which has a residue of the antimicrobials and which lead to the emergence of antimicrobial resistance. Community should be mobilized to avoid use of antibiotics and antifungals as pesticides on the plants or crops, and avoid disposing the pharmaceutical manufacturing waste in the environment, and avoid direct or indirect contact with the fecal waste that may carry traces of previously consumed antibiotics, antifungals, and antimicrobial resistance. The key messages which are very difficult to address until and unless we community participation models and effective strategies to address various target groups for these key messages. And similarly, for the food safety measures, we need to design the community participation exercise that eating or drinking unsafe food that are contaminated with feces from an infected animal can lead to various illness in the human and animals. This is a key message which need to be penetrated in the community, a very important message which address the food safety issues. And similarly, the second key message, that unsafe food with high chances of contamination, which can be listed using or consuming the unpasteurized milk, which lead to brucellosis, and consumption of undercooked meat or egg, which can lead to many of the parasitic zoonotic diseases, consumption of raw fruits and unwashed vegetables, which also lead to many diseases. And an important thing which need to be percolated in the community through community participation is to teach the community about that drinking or coming in contact with water that has been contaminated with feces from an infected animal can lead to the important zoonotic disease like leptospirosis. One important message for the food safety, which also incorporate for community participation, is importance of cleaning hands, cooking utensils and surfaces, and separate raw meat from the other foods, cooked foods to save and maintaining the meat at a safer temperature to ensure the meat hygiene. So these are the key messages when we design a community participation modeling exercises to address the food safety and security issues. So this is all about for now. This is the last key message, that when we tackle the well-being of humans, animals, and the environment together, everybody wins. So community participation is key to realize the One Health at the ground, at the grassroots level. So we should be having an empowered community with us to have to address the One Health core domains at the grassroots level. Thank you very much.